Ladies and gentlemen, I am Caroline MOUTON from Luxembourg, and I will speak to you about the high incidence of previously neglected meniscal lesions influencing knee biomechanics in association with ACL injuries. The prevalence of medial meniscus tears in ACL-injured patients have been reported to concern 15 to 34% of ACL-injured patients. For lateral meniscus tear, it concerns 11 to 42% of ACL-injured patients, and for bimeniscal tears, 5 to 16% of ACL-injured patients. This variability in reporting meniscal tears may be due first to a non-systematic approach during arthroscopy, but also to a classification of meniscal tear which is evolving over years. Last decade, we have seen an increased interest about ramp lesions to the medial meniscus and root tears to the lateral meniscus. These lesions are recognized to be associated with ACL injuries, but also to have an impact on laxity and rotational control. In case of tears to one of these structures, there may be an orthodynamic rotational laxity that may lead to poor subjective results if left untreated at the time of ACL reconstruction. The aim of this study was to identify meniscus tear pattern in a series of ACL-injured knee with a special focus on ramp lesions and posterior root lesions. The second objective was to determine whether patient and injury characteristics were associated with meniscal tear patterns. We hypothesized that there was a significant number of ACL-injured patients displaying ramp lesion and posterior root lesions, but also the meniscal lesions were associated with patient and injury characteristics. Extracted 363 primary and secondary ACL reconstructions from a single surgeon from a center-based registry. We classified the presence of associated meniscus lesions as follows. There were one group for isolated ACL injuries, three groups concerning ramp lesions to the medial meniscus and or root lesions to the lateral meniscus, and three groups for other medial meniscus and lateral meniscus lesions. Kruskal-Wallis and Kiskwa tests were used to compare meniscal tear pattern between patients and injury characteristics. Our population was mainly composed of male, 63%, patients with no previous ipsilateral ACL reconstruction, involved in level 1 sports at injury, meaning football, basketball, or handball, with a mechanism of injury which was without contact with another person, and mainly complete ACL tears. This is the distribution of the groups among our population. What we can observe is that almost 2/3 of patients had the meniscal lesions. 25% had the ramp lesions, while 30% had other medial meniscal lesions. 17% had a root tear to the lateral meniscus, and 21% had other lateral meniscus lesions. When looking at patients and injury characteristics, only gender, mechanism of injury, and type of ACL tears differed significantly between meniscal pattern. Especially for medial ramp lesion, it was more often seen in complete ACL tears, in males, and contact injuries. Findings of our study was that 2/3 of ACL reconstructed patients had additional meniscal injuries. 50% of all these injuries concerned the medial meniscus ramp and all the lateral meniscus root. These are biomechanically relevant tear types that were only recently discussed and may still be overlooked. For ramp lesion, it concerned one patient out of 4, mainly male patients, contact injuries, and complete ACL tears, which may indicate a high energy trauma. In the literature, ramp lesions are reported in up to 42% of ACL patients, but the definition and classification is still evolving, which may explain diversity in high incidence of ramp lesion in the literature. For the root tears, we observed 17% of root tears in our patient. It's up to 15% in the literature. We have here to look at the mechanism of injury. It is known that medial subluxation occurs in 25 to 65% of all ACL injuries. There was a 25 millimeters anterior displacement at the time of the injury, which can explain the presence of meniscal lesions to the posterior horn. High prevalence of medial meniscus ramp and lateral meniscus posterior root lesions shows that there should be a systematic evaluation and repair of these lesions under arthroscopy to better control postoperative dynamic rotational knee laxity of the knee. And if you want more information, I invite you to have a look at our paper published in ESSKA. Thank you for your attention.